Hello and welcome. My name is James Twose.
And I am Merlijn Olthof.
And today we will be discussing
Psychosis.
Psychosis is not an independent mental disease itself, but a common symptom among many psychiatric, neurodevelopmental, neurological and other medical conditions. The definitions of psychosis changed a lot over time. The terms neurosis and psychosis were once used as terms of severity, whereas neurosis was seen as a mild disorder. Psychosis was associated with madness and insanity. Nowadays, in the DSM-V and the ICD-10, psychosis is narrowly defined as impairment of reality testing due to hallucinations and delusions and is listed as a feature of multiple psychotic disorders. As a result, some psychotic patients may lack insight or awareness of their disorder. There are 5 key features that define psychotic disorders and occur in the affective phase of a psychotic disorder. Hallucinations. If a person has an hallucination, he or she experiences sensory perceptions without corresponding external or somatic stimulus. One example are auditory hallucinations, in which individuals hear voices that are not actually there. Delusions. Delusions are fixed false beliefs. A person with delusions has incorrect thoughts about the world and maintains them even if there is evidence against them. Disorganized speech. One example of disorganized speech is that individuals switch from one topic to the next very quickly, which impairs effective communication. Grossly disorganized or abnormal motor behavior. In this category belongs catatonic behavior, which describes a decrease in reactivity to the environment. This can range from resistance to instructions to remaining in a rigid, inappropriate or bizarre posture to a complete lack of verbal and motor responses. Negative symptoms. Negative symptoms associated with psychosis involve the reduction in the expression of emotions or the decrease in self-initiated activities.
Next, we outline the disorders which include psychosis. As already mentioned, psychosis is a common symptom along a lot of different disorders. The disorders differ in severity and duration. The most well-known psychiatric disorder associated with symptoms of psychosis is schizophrenia. Schizophrenia typically emerges between the late teens and the mid-30s and has a lifetime prevalence of 0.33 to 0.7%. Schizophrenia lasts for at least 6 months and includes at least 1 month of active phase symptoms. Other psychotic disorders may represent themselves in a similar way but last less long. Schizophreniform disorder has a duration of less than 6 months, and brief psychotic disorders are even shorter, only lasting between 1 day and 1 month. In schizoaffective disorder, the active phase symptoms of schizophrenia occur together with a manic or depressive mood episode. This episode is followed or preceded by at least 2 weeks of delusions or hallucinations without mood symptoms. Moreover, there are also substance and medication-induced psychotic disorders. As a consequence of abuse, a person can suffer from a psychosis, which is mainly accompanied by hallucinations and delusions. Besides, psychosis can be a symptom of neurocognitive disorders, such as Alzheimer's, Parkinson, and traumatic brain injury.
Schizophrenia is the name to define a complex and multifaceted psychosis characterized by 3 groups of symptoms, usually classified as positive, sensory hallucinations and bizarre ideas, negative, a decrease in motivation and social withdrawal, and cognitive, attention, reasoning and memory problems. However, people with a diagnosis of schizophrenia frequently differ in clinical manifestation and severity. From this point of view, the category could appear too broad and simplistic. It is recognized to be caused by the co-occurrence of specific environmental and genetic factors. Currently, hundreds of gene variations are identified and constitute the heritability of the disease. However, these genes are not enough. There is a missing heritability, something that the genes cannot predict and explain. Early life adversities and stress are the missing part that act beside genes in disease predisposition. For instance, pre- and postnatal medical problems, cannabis use, and social maladjustment are the most commonly recognized occurrences that can increase the risk. The interactive process between the genes and the environment along the age of development shape the brain and mind in its structural and functional organization until late adolescence, when the first acute episode of psychosis usually appears. Most scientists today think that genes and aspects of the individual's environment are complementary and necessary for schizophrenia to develop.
Now we learned something more about psychosis, but we still have to get rid of a couple of myths and misconceptions in order to understand psychosis better. Myth number 1. There's no treatment and no cure for it. This isn't true. There are all sorts of treatments. Clinical as well as social treatments are available for people with psychosis. Examples are antipsychotic medicines, family therapy and cognitive behavioral therapy. We can conclude from this that people who are having psychosis can recover successfully.
Another common myth is that once the diagnosis is given, it will never change. This isn't true. In fact, there are several reasons why diagnoses may change over time. Sometimes a diagnosis designates a very specific time frame for duration of symptoms. For example, more than 1 day but less than 1 month is called a brief psychotic disorder. More than 1 month but less than 6 months is called schizophreniform. If the person is given one of those diagnoses but symptoms continue, the diagnosis will need to be updated. Sometimes the clinicians don't have the whole picture when they assign a diagnosis. For instance, they may meet a person with depression and diagnose major depressive disorder, but later the person experiences a manic episode, which would indicate bipolar disorder. A new diagnosis would then need to be added. Periodically, the guidelines for diagnosis, the Diagnostic and Statistical Manual, are revised to reflect new information on mental illness. When this happens, symptoms may be categorized differently for scientific accuracy. Diagnoses may have new criteria, get new names, or may disappear into another category altogether.
Another myth is that people with psychosis are violent and dangerous. This stigma mostly has got to deal with the fact that the media coverage of mental illness are negatively displayed. Namely, 66% of all the coverage was associated with violence. This is a lot, and also not the case at all. It should be noted that the vast majority of persons with schizophrenia are not aggressive at all and are more frequently victimized than are individuals in the general population.
Another common misconception is that people with psychotic disorders have split or multiple personalities. People mistake, overemphasize, or underestimate certain symptoms of schizophrenia. The greatest misconception is that split or multiple personalities are symptoms of schizophrenia. Actually, split or multiple personality is more precisely and respectfully known as dissociative disorder, resulting from psychological trauma. Its confusion with schizophrenia, a psychiatric brain disorder, lies in the latter's Greek word origins meaning to split and mind. Symptoms such as drug abuse, alcohol abuse, insomnia, and disorganized speech are also not widely recognized.
Another myth is that people get psychotic all of a sudden. For about half of the people diagnosed with schizophrenia, their symptoms develop gradually over the course of months or years. For the other half, it occurs more quickly over the course of days or weeks. The prodrome is a period of time during which the person's behavior are markedly different from before and their ability to function overall declines, but they have not yet developed full psychosis. The prodrome period lasts on average from 2 to 5 years. Clinically, psychosis is seen as a stress-sensitive illness, as are many illnesses. Although sometimes it seems like symptoms just appear, psychosis is usually triggered by some perceived stress, such as a job loss or a change in relationships.
In order to learn more about personal experiences in psychosis and schizophrenia, we had an interview with Larry Grote. So this is Larry, a man of 28 years old living in Nijmegen. Larry experienced 2 psychotic episodes in his past and was diagnosed with schizophrenia. He recently finished his study in sociology and is currently giving lectures and writing blogs about schizophrenia, as well as initiating projects in positive psychology.
At age 13, Larry started to experience some difficulties. He went from the highest Dutch secondary school education, the VWO, to the HAVO, which is a level lower. Larry explained that some more difficulties for him evolved from this time until age 21. Larry's first psychotic episode started in 2009 at age 21. This first psychosis was accompanied by hallucinations, delusions, paranoia and catatonic symptoms. Because of the severity of his psychosis, he was admitted to a hospital clinic for 3 months. Labrie told us that the medication and therapy helped him through it. In the therapy he received after his first psychosis, Labrie did not have any psychoeducation and was not diagnosed with schizophrenia. Therefore he found it very difficult that he had little understanding of what he had experienced. Labrie told us that after a schizophrenic psychosis, there's an 85% chance of a new psychotic episode, but he did not know that at that time. In 2012, Larry had his second psychotic episode at age 24. Again, Larry was admitted to the hospital clinic for 3 months. This time Larry did receive the diagnosis schizophrenia. The psychoeducation helped him to understand his experience and led to a more successful recovery. In addition, he always had a strong wish and goal to get better. This was also driven by his motivation and wish to study sociology. Labrie elaborated on the following statement: people should get the diagnosis quickly, and then the diagnosis should also be removed quickly. He said it is important for people to realize their situation on the one hand, but it's also very important to get out of a disease mindset when someone is recovering. Labrie thinks it is really important for someone who experiences a psychiatric disorder in order to grow further in life.
But what is it like to experience psychosis? For Larry, both psychotic episodes were quite similar. He describes psychosis like a nightmare with full consciousness. In psychosis, you live in a totally different world. Larry explained to us that in his psychoses, he was continuously switching between two realities, the old one and the psychotic one. He always experienced a glimpse of the old reality, and he always had the feeling that something was not right in his psychotic reality. He explained that during psychosis, the meaning of all objects and people that you perceive can change, and do, sometimes very suddenly. Larry described his psychotic experience as something like the movie The Truman Show. He suddenly realized that all the people around him were actors and everything was fake. Larry said his experience was very intense. When his friends would come over to visit, they didn't do that because they loved him, but because they were hired to do so, since they were all actors. This wasn't the only delusion for Larry. He also felt like he was guilty for all kinds of world problems. He said that this was a strange situation because he also realized a lot of things in his life were quite good. His parents were there and were very supportive, he was in good health physically, and his studies went well. However, these things do not matter much in the psychotic reality. During the psychosis, Larry sometimes felt like he was not himself anymore. People also didn't recognize him as the Larry that they knew so well. He was out of office.
When Larry was psychotic, he could not sit in a room like his current living room. His attention would be grabbed by everything he would perceive: magazines, posters on the wall, the furniture, people outside the window, and even a can of Coke on his table. Larry was quickly overstimulated by everything around him, which confused him very much. Let's have a look.
Imagine that you're in a room and all objects constantly grab your attention and suddenly have certain meaning to you. The couch, the chairs, the table, the rug, the plants, the curtains, the framed pictures might display a message to you. The television, the shelves, the speakers. There might be people outside. They might be there to watch you. You can imagine that this would be very confusing. And remember, this is just one aspect of psychosis.
In a psychosis, every action requires a lot of willpower. Things like drinking water and eating were sometimes really difficult for Larry. Sometimes he couldn't eat by himself, even though he was hungry, liked the food, and was able to do it physically. The voices and delusions were so strong that they would paralyze Larry, so that he could not make the decision to take a bite. During his psychosis, Larry didn't recognize his voices as hallucinations, but as some kind of supernatural power. He explained that these voices knew him and his vulnerabilities, because they were created in his own brain.
What is the process of recovering from psychosis? Larry said that fixing the right dose of medication was very important in his recovery process. Starting medication does not normalize things immediately. The first weeks of recovery were characterized by a lot of fluctuation. Larry told us that in some weeks he could work in the garden, take a walk, and send some mails. Other weeks he couldn't do any of these things and was very confused. After his medication was at the right dose, Larry felt a lot better. He could listen to the radio again and make conversation with others. Larry described that he remembered how special it felt to be able to go to the supermarket again, or to just walk around in the city. Larry explained the feeling of recovery from psychosis as a feeling of reunion, or like getting home from an exhausting trip. Larry told us that his recovery from psychosis involved a lot of training and that it was hard work. Medication, performing yoga, going out and running were very important in this process. He said it was difficult to manage these things because he didn't have much energy. Larry explained he had an obsession to get better and to be able again to do the things he used to do. He learned that 90% of psychosis ended in 2 to 3 months, which was a positive perspective. Larry had a lot of questions about what he had experienced. He read a lot about psychosis and worked on acceptation with his psychologist. Larry explained how reading about schizophrenia, online videos and patient societies helped him a lot in understanding his situation.
Larry received and initiated a lot of social support and positive activities. He went to a student psychologist, participated in a body project, made contact with other people that experienced psychosis, did yoga, read about schizophrenia, and especially talked about it with people around him. Larry said that this helped him a lot and it was a good road for recovery. Larry thinks that in general people have a friendly approach when they know you have schizophrenia, but it also depends a lot on the person. Larry's friends still approach him in the same way as before the psychosis. In addition, he experienced a lot of understanding and social support from his environment, like his parents, his friends and his sports team. Most of the people that Larry got to know after his psychosis also reacted very positively. Larry wrote his first blog about psychosis in 2015 and since then communicates very openly about schizophrenia and his personal experiences.
Larry experiences the recovery from his psychosis as post-traumatic growth. Larry now experiences more compassion, self-insight, deeper social contact and peace of mind. He said that a lot of people think that it only gets worse after a psychosis, but this does not need to be the case. Nowadays, Larry feels like a master of his own mind. He experiences a lot of control about how he feels. Larry started making and collecting jokes about schizophrenia. Larry explained that you can get a positive view on schizophrenia this way, since people often only have negative associations with the diagnosis. If Larry now starts thinking about schizophrenia, he almost exclusively has positive associations. Larry would like to see more recovering psychiatric patients begin to make jokes about their disease. He finds that it can be a very nice way to cope with the disease.
So this was the story of Larry. A collection of Larry's jokes as well as his blog posts and current projects in positive psychology can be found on his website, findyourselfamomenttogrow.nl.
One of his projects is on promoting the thank you email. In a thank you email, you take some time to express your gratitude to someone who inspired or is important to you.
If you do this every day, it will make someone else and yourself a lot happier. And it takes only very little time. More on the thank you email can also be found on Larry's website.
We hope you now have a better understanding about psychosis and that you found this video informative. If you would like to read more about psychosis, the sources for this video can be found in the description.